my name is Harrietta Watson. I'm from Hudson, New York. Doctor's appointments and things like that, they can be difficult. But if you can speak clearly, they understand you. Some people can talk with their face. Some can't talk with their mouth. Some will type it, and then someone else tell you what they said. From the center, we have people that have their devices where they can use it so the doctor can understand what they really need.
Hi, I am Diane. My lugs are bad and so I am not allowed to have any food by mouth. I think that I was in my 30s when I had to stop eating by mouth. If I do eat by mouth, and then I have a good chance that the food will go to my lungs.
You do it. You pretend you can't talk, so I'm the doctor. So either blink for 1 or 2. There it is. You just told me what you needed.
So it helps if they're friendly, right?
Yeah.
And if they understand about you and
Yeah.
listen.
Yeah.
So what's the best advice you'd give to a doctor that's in training?
Just listen to us.
Listening is obviously the most important. To me, the reason that that's most important, we know Kevin better than anybody. We've lived with him for 47 years. And yes, the doctor gets the records, but Kevin's medical records are in a folder that thick maybe, I don't know exactly, but it's a lot. And no doctor's going to sit and look through them, or no nurse or anything else. And if they listen and you make some points in a brief summary, they will listen. But
Sometimes.
you can't, and you know, somebody may be hard to understand vocally, and somebody may not remember some important things and so on.
Yeah.
So special needs to me means that maybe that person needs some special attention.
Yeah.
Well, I think to walk in and not feel uncertain or afraid, and come forward and ask questions. Can I do this? Or hi Kev, how are you? Can you do whatever? And be a little bit freer, or ask the person, if something is bothering, right?
Yeah.
You're a super dad.
Thank you. I appreciate that.
I'm not gonna call you a knucklehead anymore.
Thanks.
And Mommy's a super mom. I'm in a good mood today.
Good.
We have good staff who understand her behaviors. They don't always understand her illnesses. We go on the appointments. I try to go on most of the appointments that I can because she's complicated. And as she stays, as she's away from home more, it's harder. I need that communication between the staff. Our staff is good. The doctors are good. They need the time and the effort to know. So they need to do their homework before they see her so they know what we're dealing with.
The perfect doctor would be someone who checks all the boxes, who speaks to the parents or the caregivers, also speaks to the patient, and as much as they can understand, brings things down to a level that they can understand and the parents can understand. So when a doctor comes into the room and he may address me or maybe not address David, but he may start to speak, or she may start to speak and start to discuss something, and then I will actually ask David, what do you think about that? And that brings the doctor's attention over to David. What they should know about David is that he's a wonderful guy. He's a pleaser. He has how many girlfriends?
101.
101. But he's
110.
110 now, sorry, we must have added a few. He's very personable, but you have to get into, you have to work yourself into his inner circle.
We need doctors to listen to us and to listen to the medical providers that are with us, because I feel that there not only needs to be a good relationship with the consumer and the individuals, but there also needs to be a good relationship with the staff members and the doctors, because a lot of us can't speak for ourselves, and a lot of us need a lot of help with the speaking part, because a lot of us get nervous because there's a lot of medical jargon out there that a lot of us don't understand. So I feel that when you have a good relationship with the individual and the staff member, it'll help you be smoother in your delivery of the care that they need.
A good doctor is will they care about you, ask you questions, if you're okay, if you're in pain. Like, if I got cerebral palsy, or if I got high blood pressure, if they got somebody with them, they can ask them what's wrong with them. You know, if they go the person very well, if they don't go the person very well, they could call their parents or their guardian or their living resident. They could call us to ask them.
Back when I was living at home with my mom, one of the experiences I had was my mom became my biggest hindrance, actually, if you can believe that, because they would always talk to my mom before they would talk to me, and they would say, "Oh, what's going on with Rich today?" And I'd always feel kind of like the third person in the room, thinking, why are these people talking to my mom when I'm 14 years old and I pretty much know what's going on with my body and stuff? But they would always talk to my mom, and I would feel 2 feet small sitting in a little shell in my wheelchair, like, why are these people talking to my mother? But since I've come to the center, that's really changed in the fact of my staff, who I work with, have really taught me how to speak to medical providers and get the best care I need for myself and other people.
I think a good healthcare provider is someone who is patient, who really can listen, who is a good listener, who can provide feedback in a manner that they understand. I think the biggest assumption would be that providers think that they can't understand just because they're disabled, that they don't understand because they can't talk the same way that we do. And in a lot of cases, our guys that are very intelligent and they really understand and they make their own decisions about what they want, but it doesn't come across to a provider like that. So then they're feeling discounted. And I know that hurts their esteem when we're trying to get them to be more independent and feel good and take control of all of the areas in their lives that they can.
I'm here to make changes, and hopefully I can help other individuals use their voice by this video and help you all understand that we just all have things to say, and we need for people to listen to us, because we're very knowledgeable people if you give us time and give us the right tools to do it.